As we told you last week, cases of influenza continue to increase across the state.
And now the first child has died from the flu in Michigan this season. I spoke with state health leaders about this concerning trend. Influenza is hitting the state hard. The CDC continues to have Michigan in the very high category for flu activity.
Influenza is not like the common cold. It can be very severe.
The state confirmed the first child death from influenza this season. It is unknown what region the child is from, but the state did say they had influenza A or H1N1. This brings the national total of child deaths from the flu this season to 103.
Nationally, of the children who have been hospitalized and the pediatric deaths associated with influenza, of those children, 88% of those children were not fully vaccinated against the flu.
Dr. Kira Siplinga is a doctor with Corewell Health, Helen DeVos Children's Hospital. She says the hospital system considers this to be a moderately severe season for flu.
So we've had seasons that are higher rates of admissions. However, we are slightly higher than last year.
However, cases of RSV and COVID peaked in December and are on the decline now. She says parents should see their child's doctor if they have a high fever, muscle aches, headaches, stomach aches, or cramps. Most of the children hospitalized with flu are dealing with dehydration or develop a secondary pneumonia.
Sometimes the inflammation of the muscles can get so severe that it leads to kidney damage. Occasionally, our pediatric patients will experience neurological symptoms such as seizures or inflammation of the brain.
Across the state, only 19.2% of kids are vaccinated against the flu.
Unfortunately, it looks like those vaccine rates dropped off during the COVID-19 pandemic and have remained lower than they were pre-pandemic, which is unfortunate. And I think some of that has to do with misinformation about vaccines in general.
Dr. Natasha Bagdasarian, Chief Medical Executive for Michigan, says it is not too late for a flu shot. The lower and decreasing vaccination rate this year is concerning for medical professionals.
If you get vaccinated, the likelihood of severe outcomes is much lower. So the likelihood of ending up in the hospital, on a ventilator, or even dying is much, much lower if you get vaccinated against diseases like influenza or COVID-19.
Yeah, so it's not too late to get that flu shot still.
Good to know.